There are actually 6 laws in Ohio. 5 of them are what we call status offenses. So you do something that is illegal, and then just because you are a person living with HIV, you get punished harder.
If you believe we can change the narrative, if you believe we can change our communities, if you believe we can change the outcomes, then we can change the world. I'm Rob Richardson. Welcome to Disruption Now. Welcome to Disruption Now. I'm your host and moderator, Rob Richardson. Today, we're going to talk about a hard subject, but one that needs to be talked about. We want to talk about what it's like to live with HIV, but most importantly, I won't say most importantly, but also challenging on top of that is what happens when you have laws that make it harder for you to live with HIV in an already difficult situation. What happens when you have laws that empower law enforcement to target and go after you, but not necessarily help or serve and protect. Well, that's what we're talking about with laws, unfortunately, here in the great state of Ohio. So, and we want to talk about what these laws have done, how we need to change them, and how they really affect the lives of of ordinary people, and why we need to be more thoughtful in how we really go about legislating laws, and how we need to be more intentional about creating laws that empower people and creating laws that don't seek to make people go underground, feel ashamed, or not actually do something that would promote their health or promote the general health of the public. So honored to have this esteemed panel with me, a team of individuals looking here to have laws that actually help and empower people and help us have a better state and move forward here in the great state of Ohio. So good to be here, and I'm glad to have you on. So let's see, where should I start? Kim, I want to start with you to really talk about these problematic laws that are in Ohio and how they got to be here. So we have laws in Ohio that essentially criminalize one for having HIV and make it very hard for you to actually go forth and let me back up. When these laws actually are crafted in such a way that they put you on trial and make the person that has HIV in a lot of situations have to prove that they are innocent instead of the state having to prove that person has done something wrong. Talk a little bit about how these laws actually came about and why they're so problematic, Kim. And then I want to actually talk to Jerry about what he thinks about this law and personally having a personal tie to understanding what people that are living with HIV are going through. So, Kim.
So, Rob, back in the late 90s, early 2000s, because there were a couple of iterations of these laws, the Ryan White program wanted each state to put into effect some sort of, or something like these laws. Pretty quickly, they realized this was a mistake and they withdrew that, but the laws were already there and have never been taken away. Yeah. The science has changed significantly since these laws were passed. At the time, we didn't know as much about how HIV is transmitted. We didn't know as much about what, we didn't have the medications that we have now. I mean, now most people can reach what's known as undetectable. And when you're undetectable, you can't transmit the virus sexually. But the laws, there are actually 6 laws in Ohio. 5 of them are what we call status offenses. So you do something that is illegal, and then just because you are a person living with HIV, you get punished harder. Wow. And then we have one that has to do with harassment with a bodily substance. So while that is illegal, then you're penalized more. Yeah. I actually think I meant to talk about the donating blood and organs.
But hold on before you get to that. I think it's very, very important. You made a very important point, which is a problem with our criminal justice system that I think is worth mentioning. That we create laws as another incentive to put people in jail or put people in jail longer. And I think we are obsessed in this country with locking people up. And it's a big problem that's costing us a lot of money, a lot of resources, and it really drains potential opportunities from people, because it's very hard once you get into the system will, as I call it, to get out. So you have these laws that are adding additional penalties that are not necessary, that are not protecting people. And it's the reason why I forgot the stats for Ohio, but I know the stats for the United States of America. We incarcerate more people than any country in the entire world, more than China, more than Russia. Name your country, name the totalitarian country, communist country, whatever you want to call that country. United States, the land of the free, right? We lock up more people than any of those countries, and that's because of laws like these.
Yeah.
Well, I think it's really important to understand where things like this come from. And there's a couple of places where it comes from. One is fear.
Yep.
Fear of, when HIV first came out, there were people in the hospital where I was working who wouldn't deliver food to patients in their room. They would leave it outside the door because they were fearful that just being in the same room, they might catch something. So fear often drives people to do strange things. But there's an additional motivation, which is
fear never drives politics, though, right? No, I'm kidding. Go ahead.
Yeah. So there's an additional aspect, which is that underrepresented populations and populations that lack political power are often subjected further to that fear mongering when laws are created. Because when can we remember that, very wealthy corporate white businessmen will be charged with a criminal offense for any reason? When you think about, whereas you're singling out a group based on a characteristic, I'm being a little tongue in cheek when I said that group, but there's a reason why, because when you think about those people who are originally identified with HIV,
yep,
it was originally people from Haiti, men who had sex with men, which in and of itself, there were many criminalization laws already on the books for things that are biologic and people cannot change their own biology. And then you had others who had blood transfusions or hemophiliacs. It was a very eclectic group of people that were suffering discrimination, but fear was really driving it. And fear then drove these laws that people were saying, okay, and there are many diseases, by the way, as an infectious disease expert, there are many diseases that can be transmitted between people. And frankly, respiratory diseases, which kill many more people every year in our country, are far more contagious. Influenza, COVID, things like that.
Let's hope the country's a little more informed on that point of view. But
yeah,
yeah, that's a.
But criminalization, just because you can transmit a disease, is really the basis of where this all came from, and it was based strictly on fear and lack of understanding.
Yeah, I mean, I agree. I mean, fear is the least productive and the most destructive emotion when it comes to legislation or human nature in general, right? But it's also the most logical. It's people understand where it comes from. Doc, before I go to Jerry, how do you navigate through that though? Like how can we learn from, we'll talk about what we need to do to change the law. I want to get to that. But how can we learn from what happened here and not follow that path of letting fear drive our decision making as a community, as a country?
Well, I think that people who are healthcare providers and scientists are familiar with diseases as things arise need to do a much better job of communicating to the public right away in a very clear and easy, understandable fashion what we know and what we don't know, and to try to address people's fears directly by making sure that we answer those kind of questions directly and that we don't put any sort of political spin one way or another on it.
Yeah.
People will see through it. I think that's what we really have to do going forward, and then try to help be the voices of reason managing through fear.
Yeah, I think it's I agree with that. I won't go too much down a tangent on this, and I want to get to Jerry. I also think it's very difficult given the state of how people get their information now to really do that. Because I do think some doctors, if you look at what happened with COVID, attempted to do that. And somehow when people discuss facts, they were suddenly labeled as one side or the other, even though you were discussing the absolute facts. So I agree with you. That's the approach. I just think we're gonna have to figure it out how to do it in this process. So Jerry, I want to get to you. You have HIV. You're living through this, and so why do you want personally, I think, to see this law change? What would it mean to you? And just talk about your personal narrative through this, through what's going on right now, right here in Ohio specifically.
Well, I've seen a lot. I've been HIV positive for the past 34 years. And I can remember when these laws came out. And personally, I think if the laws were to be changed, it would create more, actually, you wouldn't have such a witch hunt the way you have now. And it's also adding to the stigmatization of HIV, because I know for a fact many people will not get tested because of their status. They know what their status is. They have some inkling of a status, and they feel if they get tested and they know what that status is, that they're going to be further stigmatized. And there are, people are vindictive, and they will say, for instance, if someone is HIV positive and they had sex with them, and will call the law on them.
Yeah. I mean, it's so you make a point that people wouldn't. So if they get tested now and they know their status, then they can be quote unquote prosecuted if someone reports them and allegedly says that they told them that they didn't have, because then you got to prove that. Allegedly said didn't disclose that they had it. But if they, let me ask you this: so if they don't get tested and don't know, then it's okay. Is that the law? Is that the
That's what people think.
Which is crazy.
Yeah, that's
which
the way
incentivizes you not to know.
Right. And in my discussions with people, I used to be an HIV prevention educator for a number of years. And I used to talk to people honestly about my status, in group settings and, the need to get tested. And many times people would tell me, why should I get tested and be put at a risk of, possibly going to prison because somebody knows that I'm HIV positive and I had sex with them.
Yeah, which is at one point understandable, but another point very frightening, because they can also shorten their life if they don't have the medication that they need, right? Because as the point that Kim made earlier, which is something that I kind of knew but didn't really know, the fact that the science has gotten to such a point that you can live with HIV and essentially not transmit it to your partner. Is something that I still don't think a lot of people know. So I think there's a lot of education that has to be done in this area, and we can save a lot of lives. I mean, that's what it comes down to. This is a law that is penalizing people for having knowledge and taking care of their health, which is just asinine and really just backwards. So Kim, I'm curious to see what parts of the law, what does a good law look like in terms of other states we can model from, and what should we be implementing here as a better example?
A number of states have taken different tactics on this. We believe that two important things. One, right now, transmission doesn't actually have to occur for you to spend years in prison. I know somebody who didn't transmit and is spending 40 years in prison.
Wait, say that again. So
they did not transmit the virus.
Okay.
But they're still in prison for 40 years.
Like 40 years.
40. They're in year 17 of 40 years.
Oh my God.
So yeah, so transmission should be part of this formula, right? The other thing is that you should have to prove that the person intended to transmit. And that is usually in Ohio law, that's proven kind of backwards. Like if you can prove you took measures to prevent transmission, then you can't have intended to transmit. Does that make sense?
Yeah, it does.
Okay.
Yeah,
so,
but that's not, none of that's taken into consideration.
No, it's not.
It's just that if you had it and the person allegedly said that they didn't know, you can go to prison.
Yep. And we have women who are kept in domestic violence situations because they're being told, if you leave me, I will tell the police that you didn't tell me your HIV status. We have people never had a physical relationship with somebody being attempted blackmail. Like, if you don't give me this money, I'm going to go tell them we had sex and you didn't tell me you were HIV positive.
Yeah. Yeah. I mean, what was this like? So what is the reasoning now? I'm sure you've approached legislators here. What is their reasoning for maintaining this law or not making changes? Like what do they give you?
A lot of people still think this is a gay thing. And get confused as to who they're trying to do this for. Most people, when you explain the science, like if we sat down with Dr. Carl and somebody, oh yeah, that makes sense. But I think they are concerned about their constituents and that their constituents haven't heard from the doctor and may not want them in office anymore.
Yeah, well, they're scared of the political ad that's running against them to say like, oh, they did this law to take away protection from you, and it's there's that. I mean, so I guess we saw this through really empowerment and education, because I can see how this can be difficult on a lot of fronts, right? You don't necessarily have. You can have really avenues where, on both political ends, where people might not want to approach it because it's an uncomfortable area to approach, but I think it's very necessary. So how do you see, so what's the road forward? Like, how do we change this? Adam, you have any thoughts about what we need to do to change the narrative that is out there around these laws, around HIV? Like, what do you suggest?
That's a really big question. But I think it is through education. I mean, people are afraid or nervous about things that they don't understand. And, if you look at the general population, their knowledge of HIV is what it was 20, 30 years ago. It hasn't changed any. And people don't understand the progress that we've made in treatment and prevention, and that HIV is not this horribly scary thing that we have no treatment for. And I think a lot of it is based in that. And I think also being able to show that people living with HIV aren't scary. They're just people like everyone else. And there's just this whole fear attached to the virus and then attached to people that are living with it, which is completely unfounded. So I think it's a lot of educating, and the hard part is, and Jerry, I think, knows this because, as he mentioned, he did a lot of education for a long time, is it's hard to get people to listen, and it's hard to get them to look at something with fresh eyes that the media for decades and movies and all of this stuff has really been kind of like, almost performative around HIV for so long. So it's hard for people to see past that. It's like, I feel like when you talk about drug use, like I'm really immersed in exchange efforts in the state of Ohio and stuff for the past several years. And it was a similar thing. People, when they hear drug use, they picture, somebody that they saw in some movie in, an alley somewhere or whatever. And it's like, well, that's not how this looks.
No, it's your neighbor, it's your cousin, clearly.
Right. And I've had a lot of people over the years tell me they've never met anybody with HIV. And that's just not true. If you don't think that you've met anybody with HIV, then the person in your life that has HIV just hasn't disclosed to you because they're probably afraid to.
Yeah. Yeah. I mean, and there's a reason they would be, because of the stigma that's attached to it. So, Dr. Carl, so I'm wondering, we've talked about letting medical professionals lead the way. What do you think the role medical professionals can play in shaping the laws and changing the narratives here in terms of focusing here and working as hard as possible to be Switzerland on the political end while still moving the needle forward? Like, how can the medical profession help with that?
Well, I think that we need to be part of the solution. I don't know that we necessarily need to lead. I think folks like Jerry and Adam and others in the community should really be leading, but there should be a cadre of us who are healthcare providers who are providing support and information. We should be willing to talk to our legislators and explain the situation to them and try to help them see why doing this makes perfect sense. And we should really teach them the science behind it so that we can remove the fear and remove the criminalization. I look at this very much like the Me Too movement. Years ago, it was perfectly fine to discriminate against women and harass them sexually, and people thought it was okay. Now you're persona non grata if you're somebody who does that. And we need the exact same thing here for the HIV criminalization laws. We need to be able to free people who are living with a healthcare problem through no fault of their own, to be able to access the care that they need without fear of repercussion, to be able to live their lives, not be in a situation where somebody could take advantage of them, blackmail them, or worse. I've had my patients beaten up by their intimate partners when they find out that they have HIV. And I've had lots of conversations about disclosure with my patients. But I truly understand how difficult a conversation that can be, particularly when you're talking about somebody who's not a medical professional trying to talk to somebody else, and there's a personal relationship that's going on. That becomes a really hard conversation to have. I mean, just think about it. The reality is, how many of us really have a truly intimate, open, free dialogue with our partners about X, Y, or Z? A lot of times we keep a lot of things to ourselves because we don't want our partners to think this way or that way about us.
Sure.
But now you're adding criminal stakes to it, and that's just flat out wrong.
No, I mean, agreed. And just thinking about how we move forward from here, and how do we on a ground support level, on a grassroots level is the word I'm looking for, Kim. We've talked a lot about the people on the ground like Jerry and Adam should lead, but what are the triggering points for those in charge of our legislator? I think some things I can think about are the costs. I wish you could say the moral point of view, but you can also talk about the cost. How much does this cost the state in terms of people that are in prison that shouldn't be? How much does it cost the state in terms of healthcare costs that would be reduced by prevention? How much do these things tangibly cost the state in a way that affects economic growth? How much does this affect us in a way that people want to come to the state too? Because I say, people want to be in states that are, this is not only an LGBT disease, obviously HIV affects everyone, but the stigma is that you're talking about people that are just LGBT. And I believe that a lot of people in the LGBT community want laws that make sense, that are about protecting people. So it also makes us, I think, it's sort of like a black mark on the state. But how do you go about talking to legislators to get them to see this in a way that connects with their values? That's kind of my first question. I have more, but how do you go about that?
Well, first you need to talk to them.
That's true.
So with your listeners out there, when you have the opportunity to talk to your state house rep or your state senator, that's the law we're trying to change, is at the state level, to tell them that you think that the HIV criminalization laws tell them they just need to be modernized. We're not talking about getting rid of it entirely. We're talking about modernizing them, bringing them into the scientific present. But I think legislators need to hear from folks in their districts that it's okay for them to support this, right? That you want them to support it. I think it's important to talk about fairness. We talk about over incarceration. You're right about the price of this, because also there's the cost of putting somebody in prison. There's the cost of their medication while they're there. Yep. So there is a significant cost to the taxpayer for putting people living with in prison. There is talking about, that everybody deserves the right to lead a life where they're not looking over their shoulder constantly. I hear stories about people that they're worried about how many years ago did I have this relationship that's now going to come back to bite me. All right. Maybe that was the wrong way to phrase that, but that it's just a concern for people that just talking about being able to live your life, to being able to be an Ohioan, to access healthcare. Like, we have people who cross state lines to get tested because they don't want their neighbors to see their car parked in the, HIV testing facility. And so that's a thing I suspect that Cincinnati deals with. And we know that we have other border cities that have that same situation, that people should be able to access healthcare where they live and not face that stigma. But I think, people like Jerry talking and telling, the impact on not just people who are arrested under these laws, but people who are worried they're gonna be arrested or that they could be, especially since made up stuff can put them in prison. Yeah.
Jerry, as we get ready, or Adam, as we get ready to kind of wrap up, I want to get to both of you and ask you this question: what's the most important thing you want our listeners to know about this law, or what you just want them to know in general? What's the most important thing? I'll go with you, Jerry, first.
The most important thing: know what the law is, and if it, in order to change it, you have to communicate with your local legislatures at the state level, and it's possible anybody can get in touch with them via email. And I encourage everybody to get in touch with their local officials and to make some changes.
Yep, Adam.
I just wanted to say real quick the economic piece too.
Sure.
In addition to what Kim was saying, also think about the person she talked about who's been sentenced to 40 years. They're not contributing anything to the economy when they could have, and hopefully they will one day, and they'll get out and everything. And so that's a whole unknown cost that we can't really quantify. Is what are we taking away from these people, and what would they have otherwise contributed to the everybody's always worried about the economy. So what could they have already otherwise contributed? And it's something that follows them around for a long time. We're talking about felonies here. Like, that is going to follow you for the rest of your life. In some instances, people may need to register as a sex offender. And then how does that ruin your life? All these places you can't live, and you have to disclose that to your neighbors. And as part of disclosing that to your neighbors, you also are disclosing your HIV status. Like, there's a lot wrapped up there. But I think, in addition to what Jerry said, and I think he's right, like, I've been surprised over the years at how responsive, if you send an email or call, they actually are. They will email or call you back. It might be their staff, but they want to hear from their constituents. So I think that's a really big point. And then the other big one for me is just looking at it through a lens of fairness, like what Kim talked about. Like, I don't know how any reasonable person can look at these statutes and say, yep, that's fair. That is fair, because it's clearly not. So
no, agreed. Dr. Carl, final words here.
Yeah, I mean, I think as we move into this next decade and we think about how we want to treat each other, one of the better things that we can do are to remove laws that just don't make sense. And people are always talking about, oh, we have too many regulations, things like that. But these are laws that really affect people's lives. They're criminalization that's unfair, not based on any science, and they need to be changed.
Yeah. Well, to conclude on your final point, we are so quick as a society to add criminalization laws and so slow to add any other type of regulatory laws, but we want to move quickly on things that affect the personal liberty of individuals. We need to really, really take a look in the mirror and ask, is this how we want to be going forward, or can we be better? And I know we can be better. That's why we have this show. And that's why we commend all the great work like everyone we have on this panel is doing. We want you to keep doing the work. We're going to have information in the bio, so you can click on the links in this episode to learn more about how you can help, how you can contribute. Everybody can do something. Like it's when there's any type of injustice, I say this analogy all the time. It's like a wall that's there, and every one of us has to take a dent. And sometimes it takes 100 dents, sometimes it takes 1,000 dents, sometimes it takes 10,000 dents. But when it's time for that wall to come down, it comes down. It takes all of our hands, all of our muscle, all of our efforts to make that happen. So let's keep disrupting. Let's keep empowering. I appreciate everything that all of you have done, and all the listeners. Please do your part. You're here in Ohio, go out, send an email. If you're not in Ohio, still go out, send an email. Those things get the attention of legislators. It takes us collectively coming together to make a difference. Thank all of you who listen to Disruption Now. You can always find us on disruptionnow.com, find us on YouTube, or anywhere you watch podcasts. Thank you so much.